There you go.
Okay,
All right. Awesome. Awesome. So tell us, introduce yourself.
Hi, I'm
Hi.
Dr. Lissa, and I'm from Atlanta, a plastic surgeon. And I've been here for 20 years, and I've seen the whole evolution of plastic surgery.
Oh.
So that's why I decided to accept your invitation.
Thank you.
Oh,
Well,
thank
tell us about the
you.
evolution. What do you think about it?
Well, I think I'm like the first board certified female, African American female plastic surgeon in the Southeast.
Kudos to
Okay.
you. Come
All right,
on, come on.
on now. Okay.
Brag. You better brag.
You better brag.
So when I started back, they asked me, they were like, well, who are you going to operate on? And I was like, I've gone to some great places now.
I know, right?
I think I'm going to operate on your patients if you keep it up.
I know that's right.
So I did a lot of reconstructive, plastic surgery, right? And cosmetic surgery are different buckets.
Right.
Yes.
So plastic surgery, we have the plastic surgery arm, we have the reconstructive arm from the head to the toe. So we can break it down, we can put it back together. And then we have the cosmetic arm, which you can do the same thing. And so I did like breast reconstruction, which was great.
Yes.
Loved it. But when you start doing that and you're seeing mommies, right, they need to have more than just their breasts lifted.
Right.
And then I just kept migrating. But it has been a whirlwind for the African American community because it came out of nowhere. No one talked about it. And then next thing you knew, you would go to family reunion and 25% of people don't have plastic surgery.
Yes.
And no one's still talking about
Right.
it. So it's everywhere and then it's nowhere.
Yes.
Very conservative.
Yeah, it's still like that. It just depends on your social group.
Yes.
So Atlanta is, definitely a mecca for African Americans. It's been like that for 25 years at least, and it's only grown. And because it's such a great place for African Americans, you're going to get great doctors coming here.
Yeah.
And I would dare say we probably have the highest density of African American
Yes.
and plastic surgeons in the country and therefore in the world.
Yes.
Right here in Atlanta.
Yes.
And it's a great place.
Yes.
That was
So-
our overall goal, was to highlight more of the doctors here. Like, we
There are
have some
a
great
ton.
doctors
Yeah,
here.
yeah. I mean, we're all busy and doing our own thing. I mean, we all have, families that we're rearing and trying to make sure they navigate, our social, political, economic
Yes.
climate that we're in.
Right.
Yes.
That our kids aren't people that don't know us afterwards. So a lot of us do value our families. And word of mouth will carry your practice very
Yes.
well. And then in my time, social media came around. I was like, what the heck is that?
Something new to learn.
Something new.
Right. I was like, you mean you just get out there and you just like say who you are? And I was like, how boring. How boring. And then you see people and you're like, oh my God, I got to say something because this person is
Right.
wrong.
Mm-hmm.
And so, about my name, Dr. Lissa, the body snatcher, I actually did a crowdsource to my clients.
Yeah.
And they were like, well, you snatch everyone. Why don't you just be the body snatcher?
Oh, that's a
Why
good
don't
one.
you
I
do
love
it?
it. It's very
Yeah.
catchy.
Good. And that's what I did. And, when I was thinking about it, there used to be a movie called The Body Snatcher, but it was like a horror show.
Yes.
Right? So I was like, are y'all sure? Because, I'm kind of scared. They were like, trust us. We're your population. You'll be good. And
Yeah.
so that's how I came up with the name Dr. Lissa _ the body snatcher.
It's very unique, very catchy. So it's something that when you hear it, you won't forget it. So they did tell
Correctly.
you correct.
Yeah. So Atlanta's, definitely on the blow up and, people come from all over. The good thing is that Atlanta's a place where people don't mind coming from all over the world.
That's it.
So a
That's
lot
true.
of us see people from all over the world. They come here to see us because they've been looking for us.
Yes.
And that's the great thing about the internet.
Okay.
The internet can be a lot of noise,
Yes,
right? Because it's so much noise that people don't know what to do. But I do think it has a purpose. And, your podcast, like you guys actually like putting it out on the table.
Yes.
Listen to who you want to listen to, follow who you want to follow. Here it all is, here it is.
Yes.
And then you have to decide. But, like I hear people travel across the country, that's for them.
Right.
Maybe not for me.
Yeah.
But the most important thing is to have your social group, like that emotional support.
Yes.
And I feel that a lot of people really won't, don't know it until they're in a situation.
Right. Most
Like you
definitely.
getting a call.
Right.
Yes.
Help me. Yes.
Last minute.
Yeah, yeah, it's hard. Yeah.
So we do have a special request.
Mm-hmm.
We have a request. A lot of people would like for us to talk about high BMI dolls.
Yes.
Okay.
And why do we feel like people are so against the high BMI dolls having work done?
Yeah. So plastic surgeons are perfectionists. So we like to do our job and it to be like check,
Amazing.
check.
Right?
Mhm.
And so the history of plastic surgery, right, is going to be in a smaller population, talking about, the Caucasian population, the white population, their BMIs, can be like 24,
Mm-hmm.
and they're like
Very petite.
trying not to eat
Right.
at 24.
Right?
And, I came into that world and I always thought dang, what's wrong with a burger?
Right.
For me, I was I'm hungry. I'm going to eat. So I think the way it's structured right now, really the research probably hasn't been done thoroughly enough to know what are really our borders for plastic surgery. And that's why we're stretching it. And I would dare say I'm probably one of the people that is really stretching it in a more safe way because I do a lot of awake surgery because a lot of going to sleep is where the problem is, right? Because, if you are young and you have a family and you go to sleep and you get a pulmonary embolism,
Right.
debilitating if you make it, right? If you don't make it, your family is definitely devastated. Your kids are adrift without a mother. And, it's kind of just, they're out there. So because the anesthesia is a problem and then the healing can be a problem, all of that is truly magnified the larger the body mass is. Think of it as like having to cut through something. You're cutting, and you're cutting through it. Is the tissue healthy? So there are objective studies that show the larger your BMI is, that is associated with diabetes, hypertension, heart disease, hidden disease. And plastic surgery is for what? It's elective surgery for healthy people.
Yes.
Right.
So by definition, if you have a high BMI, you have to get rid of that high BMI basically. And there are places in the United States where if your BMI is above 30, you're
That's
getting
it.
plastic
Yes,
surgery.
yes. I had a surgeon tell me that, and I'm like, what? But
Me too.
I
Yeah.
have my fat in the right spots.
Right.
30.
30.
Right. Yeah. I mean, BMI basically is something that occurred. They started measuring about 200 years ago. And it's something that looks at your height and your weight, but it really doesn't look at your muscle mass, doesn't look at your ethnicity. And the muscle mass means a lot. And then when they do these studies now where they look at the components of the body, like a DEXA scan, or, you can do some of these flotation device measurements where you're getting real specific, like MRIs, where you're looking at the amount of fat in your body, you can see that a BMI doesn't equate to properly the amount of muscle. Like if you have more muscle, your BMI is higher, but your fat is not there. So they actually can do images where they can look at the amount of fat, but during the image, proving to a doctor, I'm not a big BMI girl. It's not going to work because financially it doesn't make sense.
Yeah.
So I think for the high BMI person, like for me, they have to get medical clearance, right? So because there's hidden stuff.
Yes.
Right. So if you get rid of the hidden stuff, like you're not anemic, you don't have hypertension. I like people to exercise because what are we doing this for?
Right.
Yes. If we're
Right.
not going to work on it.
Right. If I'm going to give you a gift and you're just going to splurge and blow up again,
Right.
all of this will be flat and all of this will be big.
Yes.
And we've seen that in the mall.
Yes.
Right?
In the mall.
Because I'm in the mall and I'm looking around, I'm like, flat, big, flat, big, flat. Well, and I just,
We need to unbig your back.
right. Yeah, because they didn't
Me
realize.
included.
Right. No, because, it's like if you are, a plus size woman, okay, we know you can just almost look at food and feel like, my hips getting bigger.
Right.
You just know it. It's just, that's kind of how you're made up. I'm an African-American woman and I know in my family, people are larger. So early on when I went to my family reunions, I was like, okay, wait a minute. I don't want that. I don't want that. Okay, let me rethink everything.
Right.
Yeah.
So I was just very focused on maintaining myself, doing the experiment with myself. And then when I became a plastic surgeon, I really make sure the patients that I select are on that journey.
Okay.
Oh,
They're on that like journey in their mind.
right.
So the highest BMI I've operated on is 52.
Okay.
really?
So that is quite,
Yeah.
plus size.
Yes.
But it was very specific, their concerns. I try to figure out the area that's a problem in their clothes, because little successes for someone who is a plus size woman is a huge success.
Yes.
So, something that you do for a person like, BMI 20, they'd be laughing.
Right.
What do you mean my apron? You mean my skin?
Right.
Whereas if you're a BMI of 42, we know what an apron is.
Most definitely.
What the food pot, everybody like, oh my God, if I could just. So you work on that, and it's kind of like a barter. I do a little bit, you do a little bit.
Yes.
And
Meet me
then
halfway.
before you know it, you're getting down to the range for a flat, for a tummy tuck.
Okay.
Right. So it just depends. And I mean, plastic surgery is that popular enough that there are plenty of people who will fly to Mexico and go, high BMI docs in Arizona, Florida, all that. They'll do it. But there is a downside because, I always say the winners are the ones that are always smiling.
Right.
Right. The people who are struggling and things like that, they may not highlight, but we all have to know they exist because, we're nurses. So,
Right.
there's the good, the bad, and ugly. There's a lot of good and a lot of excellent, but there's some pretty ugly stuff, probably about 10%, right?
Yes.
Yeah.
So, the question is, are you willing to take a risk? Are you a risk taker? That's what all of this comes down to.
Oh, most definitely.
Every one person sitting here, are you a risk taker?
Yeah,
Yes.
taking risks.
If you're taking a risk, that's okay. But for me, I always want people to really look at the long-term picture. Like, are you a mom? What we leaving? What's on the table? It's not you. But a lot of the women tend to be younger, which I'm thankful for because they don't usually have kids.
Yeah.
Right? So for moms who think about it, first of all, they think about themselves last. Right?
Absolutely.
And by that time, they're probably 40 pounds plus.
Yep.
Right?
Most definitely.
Right? And they're higher BMI. So I would say to them, definitely go to the doctor, make sure that you got all your ducks in a row. When you are a plus size woman, there's a higher chance of the diabetes, the hypertension, the heart disease. And hypertension is not like a simple thing,
No,
right?
it's not.
Because hypertension is going to beat up on your brain,
Kidneys.
your kidneys, and your heart, which is why a lot of young people have kidney failure.
Yeah.
Like, what are we doing on dialysis?
No. Most definitely.
I think it's the noodles. Me personally.
Everybody eating all this ramen and oozing noodles.
Noodles
that
and
could be-
fast
well,
food
it's
and all
salt.
type of
Yeah.
stuff.
It's salt, right?
Yes.
It's salt. But I mean, if they were to do that workup, make sure they take care of those fibroids, and bleeding, and the
Yeah.
anemia, because we know they always come in with
Yeah.
anemia.
Yeah.
And you can do it like, slow situation. Like take your iron, eat iron-rich protein foods, right? And then build your iron up. It's not a rush, but you got plans. We all know like, oh, my kid's getting out of high school or out of college in 4 years. It's my time.
Right.
So that's a plan right there. Get my life together, get my mammogram done, because you don't want to have anything hidden,
Most definitely.
right?
Yep.
And then you're
Make sure
having
you're healthy.
surgery. But I mean, the plus size women definitely can get a service, but I think like they're gonna have to do a lot more planning so they have control,
Yes.
right? Because control is happiness. Like
Yeah.
when you can understand things, broke it down, you got all the different parts together, and you've planned. You can still have problems, but you have a lot more control. So that's my advice for the plus size girls. Just like tee it up like you're playing golf, tee it up like
Yes.
you're hitting a ball. When your kids are running track and doing all that, you'd be Googling your doctors, Googling, maybe going to your PCP,
Right.
Yes.
Getting your
Also-
ducks in a row.
And
working out, getting what? Because that's going to be part of the maintenance program.
Ooh, most
Right.
definitely.
Yeah.
another thing I see is that when we're talking to people and they're trying to get cleared and stuff, what I recognize is a lot of people don't have a PCP, but you're trying to go get surgery.
No.
This
Correct.
is completely backwards.
Yes.
Most
yes,
definitely.
Yes. Yes.
Most definitely. There's definitely a lot of people who do not have PCPs. And I think a lot of that contributes to a lot of people now entrepreneurs.
Yeah.
So
And
they
no
don't
insurance.
they don't really have insurance. So they just kind of urgent care and emergency rooming it through life. But definitely making sure that you have a primary care doctor. So that way when it's time to have surgery, you have someone that you can go to and someone that you can fall back on as well.
Right.
afterwards.
I mean, and then, a lot of doctors have a cash-based system, right?
That's true. Yeah.
Right. I mean, people forget that. Like, just
Yeah.
because you don't have insurance don't mean you can't see a good doctor.
That's right.
I mean, a doctor will be like, okay, it's going to be $200. They may charge the insurance company $700. You see that and you freak out.
I think that's,
But what the doctor gets back in the reimbursement is much less than that.
Yeah.
And all you see is $700 and you just were there for like 30 minutes.
right.
And then the test, even like any of the imaging studies, there's a cash price. A mammogram costs like $1,000, but there are places in Decatur you can get it for $200. So it's just like being resourceful and just say, what's your cash price?
Right.
In a respectful way. Because, sometimes people are like,
In an itemized
how
bill.
much? How
Sometimes
much?
you can do
You're
an
like, wait a
itemized bill.
minute now.
But that's good information. That's really good information. So if you don't have a primary care doctor, if you need tests and things done, call and say, hey, what is your cash price?
Correct.
Yes.
Yeah. And then have a plan. Like, okay, you can look it up online. I am 40. Okay, I should probably have a mammogram. Okay, let me do that. And then, you tell them all the things you want and then ask for the cash price.
Yeah.
Right? Because you don't want to like ask for one thing and then they say you need 8 other things. You're like, what did I spend that $200 for?
Most definitely. Okay. Well, and so tell us, what all services do you offer?
So I offer a wake liposuction, a wake tummy tucks, and I offer like all types of neck lifts, face lifts, but that would be awake. Everything's pretty much awake, the stuff that I do. And then fillers and Botox. So just this very kind of, and then I will take people to the hospital if they need to go to the hospital, because I do have privileges at Northside and Piedmont. And, some people don't want to be awake. And
That's true.
I've done 2 twins.
I know.
Yeah. I've done scary.
That's
exactly.
it.
I'm very
That's
scared.
me.
Right. If you scary. Right. You scary. You scared.
This one right here.
Right. And yeah. And there's some people that's all they want. So it's it just depends on what you want. But if there are people who are like, I gotta go to sleep, and I've had 2 twins. One twin did it, no problem, and the other, and that twin took care of her.
Yeah.
And then it was her turn. I was like, "You ready?" She said, "I'm going to Northside Hospital. I am ready." And I was like, "Wait, I don't understand. Where does this come from?" She said, "I am scared to the core." She said, "I just shake because I take care of my sister." But she said, "I can't do it," and she was right. She was totally different post-op. Like it was like a Jekyll and Hyde. Like, I was like, "Wow, y'all sure you're related? Y'all look alike if y'all one part this way, one part that way." But whoa, yeah. So people know themselves.
Yeah.
So they come to me and they're like, "Oh, I need to go to sleep." I'm like, "Okay, we going to sleep." Even if they like hear the whole awake thing and they're like, "Oh, I was like, "No, you came in wanting to go to sleep. Let's sit down and talk about this again."
There's a reason.
I said, awake is like twilight, but sleep is like, I see you in the 4 hours time. Like,
so talk about the twilight. What all do you give?
Right.
Because every doctor is different.
Yeah.
Yeah. So, I mean, I think, so when people say awake, or when I say awake, I say it because I don't want people to think they're getting a breathing tube or getting IV, right?
Okay.
Because you can have IV sedation.
Right.
And still be very close to general anesthesia. And so with awake, I think the whole reason it's become very popular is that, one, we had the pandemic, and then regional anesthesia has gotten so good, which means putting something to sleep in a profound way has gotten really good. And a lot of dentists do very aggressive dental work. I mean, just think about that. They put a little needle, and then they block the tooth before the tooth they're interested in, one after that. And then they go, zzz, zzz, that's a drill.
Right.
And you're like, okay.
And respectfully, that needle is never little.
No, never.
No. And and it's like sometimes
I mean, right. It's crazy. You're right.
I mean, you think about that, and it kind of dawned on me once. I was like in a chair, and I was like, I'm so afraid of the drill. And I was like, well, maybe I can consider this laughing gas. maybe I can do this in my office. Really, it was like that.
Oh, wow.
Yeah, and then I started researching it, and I realized that dermatologists do it a lot. So you can go to a dermatologist for your saddlebags, and they'll have you stand up, and they'll be like, "Oh, but when you standing up," and I was like, "Oh, so there is a population that may be a little different like me,"
Oh, wow.
and that's where it came from, and it is very standardized in liposuction. It basically evolved from a dermatologist. They do it like Twilight. They just give you like PO sedation, and they do the regional anesthesia. That's how it started for BMIs of 18 to 24. Okay, little BMIs.
Oh, okay.
And then as we understood like the dynamics of lidocaine, because you can't give too much because there's a toxic level to everything. Too much of anything is not good.
Yeah.
When we understood that there was a large bandwidth and it was based on your height and your weight, then we decided to use that tumescent solution, right? So that's the saline, like saltwater solution, normal saline, or lactated ringers. You mix it with something that will cause the blood vessels to shrink, the epinephrine, and then you add the numbing solution, which is usually lidocaine. And then if you have 8 bags of that fluid, it's with a BMI less than 50, you could do some
Really good work.
Wow.
Busy.
Yeah.
And then you take the brain offline in a very sweet, sweet way.
That's what we call it. We're taking the brain offline.
Taking the brain offline.
Please take my brain offline.
I can see
That's a new thing.
Right.
Take my brain is offline. I don't know.
Right, she's like, yeah. I mean, it's not like anesthesia where your brain is like over here and you don't even know what's going on. But because when you go to sleep with anesthesia, it's like the lights go
Right. Instantly.
I don't even know what happened.
Whereas this, when we give you the PO sedation, everyone's different. I mean, some people use Ativan, Halcyon. I mean, they're all over, Valium. So, that is a softer landing, but you have to titrate it to each patient. Like, people who take marijuana, like it's harder to get them a little calm. So I have them stop that marijuana.
Yeah, most
Y'all
definitely.
hear that, right?
You can always tell.
You can tell 'cause
instantly.
It's not hitting right.
Well, what were you hitting last night?
It's not hitting right. I was like, oh, it's not eating right. So then I add more things to my intake. It's like, then when we come to my confirmatory, I said, did you see question number 16? They were like, yeah, it just says one thing. I said, well, click on it. I said, have you used cannabis? Any coke in the last 2 weeks? Any blah, blah, blah. Any vaping? Any this? Any that? And some people are like, what's going on here in your office? I said, no, what's going on with the population? I just need to know so we can get busy quickly.
Definitely.
Right. I want to load you properly rather than pretending, you don't do anything and I'm just
We talked about that on our very first podcast. Be open and honest so we can better accommodate you.
Yes, exactly. Let us meet you where you are, not where you want to be, not the image you're projecting.
Yeah.
Right? So, so once you do that, so pain medication, anti-anxiolytic, something to settle the stomach, and that's pretty much it.
Yeah, but you can always tell the people that smoke. They be like, Nurse Fonda, can I get 3 Percocets, 5 Benadryls?
What? Right.
It's hard for me to go to sleep.
You know what? Well, I'm going to give it to you that I can't sleep, okay? One of us got to get some rest.
I always say, that pain injection I had in my tummy tuck didn't even work. I wasted $600. Like, are you sure?
Right.
Yes.
Oh, my goodness.
But pain is always a perception. And unfortunately, the more your body sees, the more you need to get to that level. So you need to kind of withdraw. And I tell everyone before, I say, stop all that recreational stuff. Just stop it, and also with, marijuana and the munchies and all of them.
You're going to get bigger.
Right. So I was like, what are we doing here? We coming all the way over, or we just for, the family reunion or for the reunion for class? Are we trying to get cute for that? Or is this like, we're trying to take this into the future? So it's always important to know, where people kind of want to end up with their bodies. But, I love my plus size ladies and guys.
Yeah,
they're wonderful. And, they have needs. And I think with the weight loss injections, that has been
Ooh, yeah.
tremendous because, you're able to, the way I approach it is I'm able to debulk a lot before, and then I can offer them the weight loss injections, or they can do it before. But I'm very competitive, and therefore I want my people to be competitive. Like, we want to win, right? We want to be winners. And that means I want someone to do the surgery, maintain the surgery, and if they do the weight loss, do a little bit of exercise. They kind of go together.
Yeah.
I mean, I know it's like
Most
a dirty
definitely.
word for some people. They hear exercise and they're like, oh my God.
Right.
So how long do you recommend anybody to stop the weight loss injections prior to surgery?
So, for me, I really don't need it because they're awake and they can protect their airway,
Yeah.
right?
Yeah.
But reflux laying down sometimes is bad because that can be worsened,
Mm-hmm.
right? So if you're laying down, they make it more uncomfortable. I don't add Reglan. I haven't added that yet. So I usually have them, I always say, I'm giving you a gym pass because you're coming to see me.
Right. Okay.
So stop it. So I have them stop it at least a week before. But the general consensus now for anesthesia is that 2 weeks before because it delays gastric emptying.
Yes.
Remember?
Yep.
So if you're laying flat and your stomach's full, your sphincter that's there, that esophageal sphincter should stay closed. But if the stomach's full, it can
Open back
become
up.
patulous, and then you develop aspiration. And then that's another matter. So they're asking them to be off for at least 2 weeks. And I'm always like, if you're having body contouring, you're kind of jumping ahead of the line. So it's okay to miss your weight loss injections for at least 2 weeks.
And can they start back after lipo?
So, there's debate.
Okay.
There's really debate because we don't really even know for real how these weight loss medications cause weight loss. So we're still struggling with that. See, I'm a nerd. I can nerd out on this stuff. So basically, these hormones, your gut produces this hormone. All of these weight loss medications mimic that hormone, but they amplify it. Our normal gut hormone, we get full, we eat, and we done. It goes away. The hormone goes away, and then we're looking for more food. When you have these weight loss injections, it mimics the hormone. It stays there longer. So you have satiety. You're just full. And then gastric emptying slows. And then it actually sends a signal to the brain to tell the brain, you're full. You're full. But we're not really sure how it's causing the weight loss because it causes the blood glucose to go down, right? You get all these heart healthy benefits. But what is it doing to the liver? Why is it mobilizing this fat so quickly? We're still working on that.
Because I did have one young lady, she had a BBL, and she was taking a semaglutide before the surgery. And so after the surgery, she was ready to go home, and she was like, I'm going to stop at my doctor's office and pick up my semaglutide. And I thought, right, that's what I told her.
no.
I was like, you should probably talk to somebody about that. And so she was like, but they already told me to come and get it.
No,
and I was like,
they weren't thinking.
That's what I told her. I was like, it doesn't really add up. I said, I'm not sure how it all works. I said, but it doesn't make sense if they put this fat in your booty and then you're going to take a shot for weight loss. It seems like you're kind of,
Correct.
going against what you just done. And she was like, oh, I didn't even think about that.
Right.
I was like, I mean, you might just want to talk to somebody, a doctor. I said, I'm no doctor, but it just, that doesn't add up at all.
Or when they lose weight after without the medications, they're like, oh, now I'm going to go on a diet and you just had surgery. That's not going to help your healing process at all.
Right. Because, in order to heal, you need the foundations, right? You need the protein, you need those carbs because you go into something we used to call the nitrogen deficit, which means once you have surgery, your body goes revving up and it needs to pull everything from the liver, all those stores from the liver. It'll just start breaking down muscle mass if you don't feed your body. It'll get to the fat, but it'll just start breaking down muscle mass, whatever's fastest. And, we know fat loves our body once it's on our body.
Right.
You don't lose your fat. You'll break down your muscle before that. And so I usually have people have a protein-rich diet. I make sure that everything's corrected. They're off their narcotics. They're feeling like about 80% normal. And then I make sure their healing is appropriate. which usually I know it's okay between 3 and 4 weeks. And then depending on what I've done, they'll go on the weight loss injections. I am not a fan of like doing a BBL and then putting on a weight loss injection because it just sounds counterintuitive. Like, as you do it, like, I'm giving it to you, and now I'm gonna expect this little chemical to just take it
out
from
of your
thighs.
Yes, targeted fat loss.
Yeah. And I have read some things online that people say their butt is getting smaller, so it must happen. And remember, like, this is all new to everyone, right? Because like Mounjaro got approved like May of last year, May of 2023, and Mounjaro is like it's like the 2x weight loss. It works by 2 separate mechanisms, so it's like stronger than the Ozempic, and it causes more weight loss. And in my hands, and from what I'm seeing in my experience and my colleagues, is that it even targets this trunk fat. But because it's a more aggressive weight loss, I'm just wondering what's going to do with the BBLs. I'm just sitting back and waiting because I'll do small BBLs. I'm never into these big booties because it's not me. After a while, you have to do what you love, right?
Yeah.
And it doesn't make sense. And we all know that fat is very kind of fragile when you place it there. So keeping that investment is important. So you either do the weight loss injections before you get down to your baseline weight, and then in doing that, right, all that good fat is going, right?
Yeah, that's true.
So this is a whole process and evolution. I'm sure there are doctors who do a lot of BBLs who, aren't at a meat market, place where they do 20 a day or 8 a day.
Right.
The doctors who do it and kind of watch their clients, they're probably coming up with a new protocol on how to preserve the butt and get to the size they want to get to. But it's a challenge right now.
Yeah. And it's definitely like a borderline between losing weight and making sure you have enough fat for surgery.
Correct.
I had a young lady text me just 2 days ago. She was like, "Hey, Nurse Fonda." She was like, "I want to lose like 10 more pounds. I want to get down to, like 150. She was like, "But, I feel like I'm okay at 160. I think she was like 165. And I said, "Well, you want to make sure you have enough fat for your new booty." And she was like, "I didn't even think about that." I was like, "Yeah, you don't want to continue to lose all this weight. And then you get to your doctor's appointment
and they don't have
like,
enough.
Yeah, I don't have enough fat to work with."
Right.
So it's kind of like a catch-22. So what do you feel like is a good BMI for people to kind of
For what?
to have like a really nice, decent BBL? It's kind of hard. It's kind of like per person, right?
It's hard because it depends on your frame.
That's that's true,
right?
Where you carry your fat.
Frame,
Where you carry your
and
fat.
no, like some women are broad chested. They have broad shoulders and they have narrow waists. I mean, narrow hips. So they need like hips and butt. So it really depends, right, on the person. It's pretty. It can be complex. But the real challenge right now is that when you take the semaglutides or you take these GLP-1 drugs, it's really going to affect from the head to the toe, right? So you don't know. And we don't know. It's new. It's new territory. It truly is new. I think if you want a good butt, then you probably just need to get to the BMI where your doctor will let you be able to have the surgery, and then go from there. I probably would wait like 6 months at least before I would start. I want to make sure my butt is thriving. Thriving. I can sit on it. Have fun. No high-fitting jeans.
Yes.
Right?
Yes.
So that when you start your semaglutide, you're like, whoa, wait, I'm stopping.
Yes.
Because you got to know.
Right.
Let me tell you. So I started my shots and I had lost 8 pounds like that. So I was telling Fonda, I put on these pair of jeans and I have like a loose part in my butt part. And I'm like, whoa, I need to stop this next week. Because you just can't really tell where it's going to come from.
Correct.
And then I saw one surgeon in Beverly Hills. I think his name is Dr. Kevin somebody. Don't quote me on that. But he said with the injections, you can have muscle wasting.
Correct. So
if you're not eating enough protein. So now I'm worried about that.
Right. So I kind of alluded to that. Remember I said when your body needs, it needs what it needs.
Right.
And the muscle is very easy to mobilize. It wants to break it down. And there is something about these GLP-1s that people just don't have an appetite. I mean, I had someone in my office that said they didn't eat for 3 days, and I was like, I'm going to fire you because you can't be in the medical office talking crazy like that.
Yeah.
I said, you cannot
Right.
not eat for 3 days. I said, that is unheard of.
Mm-hmm.
I said, you're doing damage to yourself.
Mm-hmm.
And, even though you're telling me you're doing this, I said, it doesn't even make sense because it suppresses it so much, you forget to eat. And so what is your body going to do? It got to live.
Mm-hmm.
It's going to break the muscle down. And what we're afraid of is that you break down so much muscle. Like, let's say 60% muscle, 40% fat. If you break down muscle, right, while you're on these GLP-1 products, maybe you go up to 60% fat, 40% muscle. And that's bad,
Yeah,
right? Because
that is
we know
bad.
the heart healthy benefits go away for sure. So, I mean, I always tell people you want to live a long, long time,
Yeah.
right? So you can have all the plastic surgery you want. You can look as good as you want. But in the end, it's like your internal clock that matters,
Yep.
right? How good looking your organs are.
Mm-hmm.
So if you have a lot of heart disease, if you have a lot of fat, and in turn, perhaps more atherosclerotic disease, the plaque,
Right.
the gunk in your arteries, it's not going to end well for you.
Yeah.
Mm-hmm.
It's not gonna matter.
It's not going to matter because you're going to have, you're going to have the consequence of the heart disease, you're going to have hypertension, or you're going to have a stroke. And so I think I'm happy people are having plastic surgery because we're caring about ourselves,
Mhm.
right? So
Right.
we're like, ooh, I want to look good.
Right.
But if we could just turn that lens to the inside of ourselves, right, we would live longer, healthier lives.
Yes.
And look good. While
And
we're
look
at
good.
it, right?
And look good.
Look good, feel
and-
good.
Right.
Mhm.
And, because of the melanin in our skin, I mean, we really, really give people a run for their money.
Yes.
At certain ages.
Mhm. Right.
I mean,
Most
yes.
definitely.
Yeah, I saw Tracy Chapman on, was the Grammys, and I
Yes.
was like,
Mhm.
look at her.
Look,
Yes.
she's amazing.
Amazing.
Yes.
She's been very organic. And here she is looking wonderful. So we
Yes.
just have to give ourselves a chance.
What advice would you give someone that has visceral fat?
Oh yeah.
Right. That's belly fat.
Yes.
Mhm.
So, yeah. So, unfortunately, belly fat, and I tell people this, and there's genetic distribution,
Mhm.
right? Because you can look like your dad, and therefore you kind of thick in the middle.
And my daddy is very thick in the middle. Mm-hmm.
No, because we came from somewhere. We didn't drop from outer
Yes.
space. It's the mama or the dad, which one?
Right.
The brother, the sister. I mean,
Somebody.
the auntie, somebody.
Right.
Right. That's why I said family reunion. I was like, when you go to your family reunion, look around.
Mm-hmm.
Look around. Look on your father's side, your mom's side. See where your body
Yes.
is. You're going to see like a twin somewhere.
Right.
Okay. So that twin's going to be 20 years older,
Mm-hmm.
50 years older.
Mhm.
Okay. Those are your, those are the highlights. Those are the area, your Achilles heel. That's where you're going to gain your weight.
Mm-hmm.
Plan. Why wouldn't you plan?
Mm-hmm.
So
Right.
visceral fat in the middle. So visceral fat, unfortunately, is old diet and exercise and planning, which means, exercising so that you don't develop the visceral fat. But more importantly to me now, it really is my journal. My journal is like working miracles for my men.
And it's so
Really?
hard to find because I have a prescription. They said not within 50 miles.
Right.
50
Yes,
miles.
correct. So this is what
Call
happens.
my dog.
Call your doctor. That's it. Call your doctor.
You're going to have to call an
Right,
out-of-state
right.
pharmacy.
Right.
I'll drive.
So, right, yeah. But, we have this funny law in America that when there is a shortage of a product, right, the pharmacies can do the compounding of
Right.
a drug.
Mhm.
And there are FDA licensed, right, pharmacies that make the generic Moderna.
Oh, and that's a compound pharmacy that some of my patients use sometimes in Dunwoody.
Yep, done
Done
with
with
it.
the pharmacy,
Yep.
yeah. It's a
They're
compound.
everywhere. No,
Oh,
they're everywhere.
wow.
They're national companies now. I mean, I have 4 of them that I use, and I have it compounded because, I want to look at the profile of it to make sure that, the company is FDA approved, hasn't had any complaints. So there are ways you can go online and look up whether the compounding pharmacy has had any complaints. And then a lot of them have affiliated with doctors. So you get your online,
Mhm.
assessment. and then they can ship the medication to you. Now, am I an advocate of that? I'm somewhat concerned because if you have a side effect, will you be seeing the same doctor?
Right.
Well, will they be able to assess you tightly? But if you've been on the product, right, and you want to stay on the product, it's probably okay to do it because I don't 25 units is all you need of tirzepatide, right? And you've been with a doctor, so you can kind of graduate, from the doctor to telemedicine. But these compounding pharmacies, people don't know about it. And a lot of doctors in the community actually do have it. So they have access to the product, either Wegovy or semaglutide, or to tirzepatide, which is the generic name for Moderna, right? Remember, when you say those names like Moderna and you say Ozempic, you should say like Mercedes-Benz, Rolls-Royce, because that's the kind of money you're spending up there if you have to come out of pocket.
Right.
And then when you are using the generic, you're probably going to pay about 1/3 to 1/2. There's still a saving, and if you have a health savings account, it's even better. So you can slide the card for that because that's important.
Yep.
Right.
And you just need to talk to your tax accountant and see, because I just think like, it has heart healthy benefits. If you have high blood pressure, you
Which I do.
qualify. Right. Yeah. So I'm thinking it's a health write-off. That's what I'm thinking.
That's a good
I didn't even
point.
think about
Me
that.
either.
That's what I'm thinking.
Oh, wow.
Yeah, because I got codes. I use codes all the time. People use codes.
Right.
Yeah, I mean, it's worth it getting that little code. Okay, obese, that's okay, not for long. Give me that
Right.
code.
Yeah.
And then you write the medication. You should be able to get it, addressed with your taxes. Yeah.
Wow. Dr. Lisa, you're
Hit me
so
some
smart.
codes. I know.
I'm
I
trying.
didn't
I'm
even think
trying.
about
I
that.
told you I could nerd out. I told you I could do it.
You are so
Can't help
smart.
it. Can't help it.
Oh my goodness. So tell us about your tummy tucks. How do you do tummy tucks awake? I don't think I know anyone else that's doing that. That is awesome.
So I know people think awake and they freak out.
Oh,
so
my.
you were like Twilight. That's probably the best way to think about it, right?
Twilight Zone.
So Twilight is like, like your kids come to your bedside, right? You got niece, nephew, someone, and they're like, your covers over your head. You just, it's like, do not bother me. And they're like, hello. And you're like, you rise up, you pull the cover. What do you want? You tell them what they want. You put the covers back on your head, but they stay there. You sleepy, so you're doing this. You're still going down. You know they're there, but you're going down. Just before you do that and fall off.
Oh, gotcha. Okay.
You know that one.
Okay, right.
Right. So, and the surgery takes place in that place. Right there.
In and
So
out.
so we do give you some more medication during the procedure if needed. And then everything is numb, like when you tap your jaw when you're at the dentist. And you may feel some pulling, but I even move the belly button now. So it's a real tummy tuck.
So it's almost like a C-section. That's what it sounds like to me.
Yeah, that's probably right. It's probably more like a C-section. So I think in 10 years, like if you go to sleep for liposuction, first time liposuction, you may have issues, or you're just incredibly scared.
So you think the world is moving more towards away from the
Why wouldn't?
because
It's
a lot
safer. A lot
It's
safer.
safer.
And it opens the population up a lot more as far as clientele for surgeons.
Right. I mean, it does open up the population, but now we're down to plastic surgery. People think liposuction is simple, but when you go to larger volumes, right? As you know, what dehydration?
Yes.
Oh, yes.
Dizziness, and we always have to worry about like minimizing the complications and the risk. So, I mean, when you take care of a plus size doll, you got to have a few other tools in your shed.
Yeah.
You can't just be your little liposuction cannula. Let me do this and run.
Yeah.
Right.
It's like, okay, how's this person doing that night? You have to be able to assess them, make sure they're not dizzy. You really have to kind of have your hand on the pulse of what's going on with the patient. You have to turn them over to the proper nurse.
Right.
I mean, like someone who knows, they're like, well, Dr. Lisa's not going to like this. Let me call her. Or I'm going to take you to the emergency room. I don't even talk to her. Or I need to order IV because I know she wants it.
Yes.
So for my plus size women, I do tell them and men that, you may need to have an IV. I don't know. It just depends on how much, how you react to the surgery. Because in Georgia, we can remove 5 liters of fat. Now, everybody's like, okay. Well, in Florida, they can only remove 4. So why is that? Why is that?
I don't know. Why is that?
They've been naughty.
Oh, doing too much.
Yeah, of course.
Yep. Because 10 years ago, we were hearing story after story
yeah.
of drama.
Most definitely.
And the state board was like, no, we're not going to have this. I know how we'll do this. We're going to make something objective. If we see more than 4 liters, it's falling on the surgery center and the doctor. So now they know. Now, some people are like, I have had some people call my office. They're like, well, since you got your own surgery center, you can take more fat out than that. And I'm like, okay, that one right there? No.
Nope.
Because
Not on my license.
Right.
yes,
That
the
you work
license
so
of
hard for.
everybody.
Yeah,
The
most
license of everybody.
definitely.
It's collusion, right? And I think people don't understand that. And that's what I mean. Like when you say, wake liposuction and it opens up the floor or opens up the population for other people, it's very serious though.
Yeah.
It's not to be taken lightly. And that's what I really worry about.
Yeah.
So hopefully with this podcast, people kind of understand, even though you're a plus size doll or you're a plus size woman or man, that, I'm different and I have to really be ready to take on the surgery. It's not just a pit stop.
No.
Right.
And then I'm small. Because, when you watch them heal, fluid everywhere.
Oh,
It's
my
drama.
goodness.
It's
Isn't it?
drama fine.
Yes.
Very.
It's running down the legs. And I'm sure it's like,
Yeah, it's a lot.
I didn't know I would be leaking like this. What is this?
Oh, funny story. So I was talking to my hairstylist, right? We was talking about plastic surgery and stuff. And she said, I guess she went out of the country to have hers done. And so they always use drains, she said. So she went to pick her friend up from the surgery center here in Georgia, in Atlanta. And she said her friend came walking towards her car, all that bleeding. She said, oh, you need to call somebody else. Because you cannot get in my car like this. What is going on? I said, no one told. She said, no, I didn't know. She was like, I really thought she was going to have drains. It was going to be okay. I had like a little towel laying down in my seat. She was like, but she was bleeding everywhere. She was like, luckily one of her other friends had showed up and she let her get in her car. But she said, 'cause I told her, baby, you can't get in my car.
They come so unprepared. I had surgery sisters that one initially booked with me, the other didn't. So they had their adoptive daughter down. And when I looked in her car, I said, where are your chuck pads? She's like, what are you talking about?
Right.
So I had to layer the car for her. And she's like, oh my gosh, we did not know any of this.
Yeah.
really?
Of
I
it.
thought the internet had a lot of that on there.
I mean,
Because, I always tell people to kind of stay away, I figured that would go to the top, like gore.
Listen.
No, the gore. Anytime something's gory or crazy, it should go to the top of the search, right?
listen,
They're not prepared.
they're not prepared. And
all.
that's one of the reasons why we wanted to do this, is because it's so many people that we see every day that are not just mentally, physically prepared for what they're about to go through.
Yeah. Because it's a journey. That's what we tell people.
Yeah,
It's definitely
it is.
a journey. And I know you talked about removing the 5 liters. One thing people do is they want to get on the scale. For some reason, they think removing 5 liters of fat
right away,
is going to
10
drop
pounds.
them.
Boom. Not right now.
I'm the same way I was but worse.
Lord, don't let them gain weight. Oh, my God.
Calling you.
What did she take? I done gained 2 pounds. Oh, Lord.
Yeah, I tell people do not get on the scale
Me
for
too.
1 month. But, I get it because you're just like, what's the difference? But it's water weight.
Right, yeah.
And you can take like a Lasix and lose 5 pounds.
Oh,
Take a
wow.
Lasix
Ooh,
Saturday,
yeah.
and by Monday you're like, 5 pounds off, yay. But so if you do lipo, you take the fat off, but then the body reacts to the surgery.
Oh, okay. Right.
So it's going to draw all that fluid into the tissues, therefore the lightheadedness. Right? Because it's drawing from your blood. You guys know. So that water weight means weight. But I think also we should just tell them it could be a crime scene sometime post-op. Hello, right? Yes. It's everywhere. I mean, I keep it as basic as I can. Like when they say chucks, I was like, puppy pads?
Right.
Puppy pads. We know puppy pads
Right.
everywhere. And they're like, well, I think I like towels. I said, no. you're going to want to do this to it, tie it up, throw it in garbage. I guarantee you,
You don't want to wash
your
that.
soak,
Yes.
right? Your soak towels and wash them or give them to your boyfriend or your mom or someone. They're like, what is going on? You know, they're doing laundry and probably praying.
What did they do? What they do to her?
Yes, most definitely.
No, you can't have that.
Oh,
That's
yeah.
crazy.
Yeah.
Yeah.
So, and as far as like your tummy tucks, how do you notice? Well, what makes you decide if you're going to do a tummy tuck versus a tummy tuck with a muscle repair?
Right. So it depends on how big the baby is, right? So there's some women who have one baby, and you look at their abdomen, you're like, just one baby, right? Because they still look pregnant, right? So you look at their pictures before, and then you see they have the diastasis. The muscles are split, right? So if the muscles are split, then definitely they're a candidate. And usually the BMI is lower, right? So the BMI on those women, they're small women having these big babies. The baby can lie like this way, right in the middle, like a U. Push, 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 everything tears. So those patients, I will tell them and counsel them to have a full tummy tuck if that's their last child. Now, if it's not their last child, you know, now the question is, do you go and do all this surgery, look
Only
better,
to then have one
and
more-
then they're
yeah.
pregnant again? So usually with those patients who want to have more children, I'll do like some liposuction and maybe a little skin removal, like a mini tuck, because they're not really sure if they're going to have more children. And if they're married and, you know, there's no everybody's employed, another baby's
like
coming.
that
Another baby coming. Y'all just don't know. I look around. I'm like, wait, y'all employed. Y'all got one child. That one going to be lonely. And y'all going to want that one to have somebody to play with. Cause y'all,
Right. Most
Yeah.
definitely. So tell us about your consultation process.
Yeah. So consultation process starts with basically a patient care consultant who basically will interview a client, just make sure we can address their concerns. So if they want liposuction, body contouring, face contouring, medical issues have to be addressed to make sure that they are ideal candidate. And then once they know they're a candidate, they give them like a price range. And then once they feel like that's a good price for them and they want to move forward, then I review it to make sure everything is correct. Pricing is correct. The surgery is appropriate. And then they come to see me. So that's that confirmatory visit. And they get information from our office after that. Most of it's like internet based because everything's online. So I usually am tracking people, you know, through like our texting system or our closed network. So I know who's coming through. And then I meet with them. Some people come from far, so we'll do a virtual.
Okay.
So the virtual is done. I have their pictures. We have them upload pictures. And then we have a closed network again where they see the portal, and they see the pictures. And I pretty much listen to them because, you know, listening, you learn a lot about what their real goals are. Because sometimes you can have some miscommunication,
Oh, most definitely.
right? You know, they think they want liposuction, but they really want to be flat. So if you hear flat, you're like, okay, there is one definitive way, right? Tummy tuck. And then you have to make sure, you know, they're a candidate. So I do the confirmatory. I check all their labs because I'm just a firm believer in being proactive, not reactive, right? I just like that. And you have to have labs within the last 6 months to a year.
Oh, okay.
6 months to 3 months.
Okay.
And have no medical problems,
Okay.
right? So if you have medical problems or you're on like high blood pressure medications, you can have electrolyte problems, right? And remember, everyone coming to us is new. Like, I don't know them. I'm not their primary care doctor. So I like them to have medical clearance because medical clearance just lets their primary care doctor know that they're having surgery. I mean, to me, it's like almost like a form of respect. It's like, I'm
Right.
going to operate on your patient. I'm letting you know. And, you know, sometimes people don't want the doctor to know what they're doing. So I just say, well, you're having plastic surgery or cosmetic surgery. And I leave that out. And then, you know, I kind of model to them, you know, before and afters just to make sure we're on the same page. And, you know, talk to them about like how their clothes fit, stuff like that. And just reconfirm their concerns and then the procedure that they're having done. So that's really the consultation process right there. Very straightforward.
That's good.
It's just confirming everything. And then I think the most important thing is how do you get your surgery canceled, right?
Yes, please tell us about that.
Right.
Oh,
And
that
I
is.
can
'Cause it
imagine
happens.
smoking.
Right, exactly. Smoking,
Lying
right?
on the
One,
forms.
smoking, not getting those, your labs, right? Having some chest discomfort and not addressing it.
Pregnancy.
Yeah, pregnancy, pregnancy, right? But the most important thing, showing up here without anybody,
Oh,
Yes.
showing up alone.
Yeah.
showing up alone.
I'm going to be in my hotel room bleeding by myself.
Right, that
Foolish.
is very.
That
yeah.
is, people really do. They really
Yes.
show up here like, you mean I can't drive myself home?
I can't get an
No.
Uber. I can't get a Lyft.
I mean, how common is that?
People are.
Like, is it like 1/3 people?
No, you'd
Every
be
month?
surprised.
Yeah, you'd be real
I
surprised.
just had one that left.
I had one. I had watched this one girl's story on Instagram, and she tricked the surgery center.
Oh,
She said she gave them her cousin's phone number,
okay.
and so they called
So
her
we
cousin.
called her. Yeah, we text the cousin.
We told her she was done, right? So then she said that she had her cousin to then call the Uber for her. So then when the people got downstairs, her cousin was like, they're there. So she had the people to wheel her down. Of course, her cousin sent her a screenshot of the Uber, the car and stuff. So she was like, oh, that's the car right there. That's my cousin right there. So the lady was like, she said that the nurse was like, that looks like an Uber, And she was like, no, that's my cousin. That's my cousin. So, but you have to sign. So, of course, the guy was like, no, I'm an Uber driver. I'm not signing anything.
Okay.
So, but the lady was like, she was already downstairs. And she was like, you know what? I don't have time for this. So the nurse went in and put her on the car and let her go.
You remember last year, a doctor called me, a doctor's office,
Oh,
kept
yeah.
calling me. And I'm like, who is this? So I answered the phone. And why haven't you picked up the phone? Your patient is ready. I'm like, who? She never paid a deposit,
Right.
never did anything. And so she tricked these people into believing that I
Yeah.
was her nurse, gave them my information. They called me and I said, listen, I don't know this lady's first name, last name, anything. We just had a brief conversation. She got my number from Instagram and
Wow.
yeah.
Mm-hmm.
So they said, we will pay you to come and take care of her. But it's like, it's crazy.
Yeah. People do
It's
it.
crazy.
Yeah, that's sad. I mean, I know for us, we actually make sure the family member comes in. So we never let the patient come in by themselves.
Yeah.
That's a good thing.
Right.
That is a good thing.
And then we send them something through our closed network and they have to confirm.
Mm-hmm.
If they don't confirm, we're like, wait a minute, wait, this didn't come through. What's going on? What did they do? But I mean, it's unfortunate that people devalue their lives and they don't realize it. Because, everyone gets in trouble. Like the surgery center gets in trouble. I mean, everybody gets in trouble. It's a takedown of the doctor, the nurses, and not to mention the patient is suffering.
Right.
So I just think it's, people shouldn't think of it as a game because people get hurt.
Yeah.
Most definitely. People
Yeah.
do get hurt and it's very serious. So we just want to say thank
Thank
you
you
so
so
much
much for joining
today.
us.
This was an awesome session. So
Yes.
tell everyone how they can get in touch with you.
Yes, I'm Dr. Lissa, based in Atlanta, and it's www.drlissa with 2 S's, and it's Dr. Lissa _ the Body Snatcher on IG, and I'm also on YouTube. So
All
thank you very much, ladies.
Thank
Thank
you
you
for
so
your
much for having me.
time.
This is
Awesome.
wonderful.
Yes. Thank you.
Yes.